Hi everyone, as promised, I am working on making this presentation for the major policy changes and updates. With the new policies that were made in 2018, obviously we've done pretty much a reconstruction of the entire C1 and C2 policies, so this presentation is designed to help guide directors or anyone that the policies could affect in the nutrition programs. Most of the information, or all of the information in this presentation, I've already addressed in the calls that we've had about the policies, but I went ahead and accumulated things based on final changes after getting feedback from all of the service providers. An overview of the presentation, basically I just have the presentation split up into 3 sections. So the first being Title 3C specific policies, so this will affect both C1 and C2. Title 3 C1 specific policies, so obviously just affecting C1, and then finally just the policies that affect C2. At the end of the presentation, I have a list of documents I've created, both that are found in the appendix and also just resources available on the website. So go ahead and getting started with the policies that affect C1 and C2. The first is voluntary contributions policy information. The policy here is that us at the division are going to be monitoring and approving voluntary contribution practices and how you're implementing and developing those for service provider based on the evaluation process. So basically service providers need to be developing and submitting an internal policy of voluntary contributions and their solicitation practices to the division. This will be due with the grant applications each federal fiscal year. And then I do have just an information policy sheet about voluntary contributions, which basically details what information we want from you regarding voluntary contributions. The next policy is regarding guest fees. Guest fees are required. They aren't voluntary or confidential as opposed to voluntary contributions. If the nutrition program does have funding available to offer discounted meals to guests, which could include staff or other individuals, they can offer those at a discounted rate, but they do have to make up that guest fee amount difference, which is determined by the standardized cost sheet for nutrition programs. Meal programs shall complete this tool, which is referred to as the meal cost tool, annually. Most likely it will be due in the middle of October due to the fact that I need information from the prior federal fiscal year, so you won't be able to turn it in with the grant applications. Meal sites must notify the division when the guest fee amount has changed and then the rationale behind the change. And then please note too that additional training will be provided regarding the standardized cost sheet, which is also the meal cost tool. It'll probably be available in a few months so that you have time to play with it and get used to it before it will be required. The next policy is regarding emergency situations. In emergency situations at a meal site, when a meal or menu has not been approved by a RD before service, facilities can have the option to have the RD approve the menu at a later time. Approval and notification has to be given to the division regarding the emergency and then the food that was served. Meals can be considered eligible so long as the meal meets the Older Americans Act nutrient requirements and it has been approved within 2 weeks of the emergency situation. The next is regarding foodborne illness outbreaks, and the main thing to take away here is that the division should be notified within 24 hours once the service provider is aware of the possible outbreak. Please just know that at the division we want to be aware and know of outbreaks as soon as you are aware as well. The next policy is regarding food procurement, specifically meat donations. Documentation of all livestock and wild game donations must include the name of the donor, the date of the donation, and the date and name of the plant where the animal was slaughtered or processed. A record of the meals that contain these foods must be maintained. An exception to that is that nutrition programs receiving numerous livestock donations have the option to submit a waiver request that disregards keeping the record of the meals that contain the donated foods. We've determined that this can be completed if the nutrition program receives more than 1 donated livestock. If anyone has any specific questions, they are more than welcome to talk to myself or the CLS manager. Continuing with meat donations, if wild game is served, it has to be listed on the menu as wild game. And then programs wishing to accept eggs and other food donations must adhere to the Wyoming food safety rule and work with the local health department to ensure that they are in compliance with food safety standards. Continuing with food procurement, we have locally grown produce. Nutrition programs may choose to utilize donated locally grown produce in the nutrition program and shall ensure that all produce is wholesome and of good quality. They also have the option to utilize donated locally grown produce, but if they don't want to, then obviously that's an option as well. All donated locally grown produce shall be donated by the raw agricultural producer. And then similarly to the meat donations, we require the following: the item that's being donated, the date of the donation, and then the agency or grower making the donation. And also the date the donation was served to eligible participants. Moving on, we have a section regarding volunteers. The nutrition programs do have the option of offering a meal to volunteers who provide meal-related services. These individuals have to complete the division-approved volunteer form or also a volunteer form provided by the nutrition program. The big change here is that volunteers no longer have to fill out an AGNAS to receive a meal as part of their service. You can have the option to use a different form as long as it has that minimum information that's provided on our volunteer form that we have given you. Also regarding volunteers, a written policy and procedure shall be developed and implemented that describes how and when non-elderly volunteers are eligible to receive meals on a contribution basis. So if you have someone who provides 8 hours of service versus someone who provides 4, it's up to you and if you want to serve them a meal or not, but how you do that and how you determine that has to be documented in a written policy at your site. And then finally, with the volunteers, nutrition programs shall again have an internal policy regarding monitoring and recording of volunteer hour tracking for in-kind values. The example here is that if nutrition programs may have an internal policy stating that tracking of volunteer time will be kept by a daily schedule that the volunteers will sign for approval each month. Basically, this is preventing volunteers from having to sign a daily log sheet, but we are required to have some sort of policy written at your meal site that determines how you're tracking those in-kind values. Food safety training, there's 2 specific policies with this. The first is that food safety education shall be provided at all meal sites, at least each federal fiscal year, and then food safety and service training shall be provided for all paid food service personnel, at least annually, and all volunteers shall be provided food safety information at least annually. Please note too that I will do my best to provide you with as many resources as I can. There are a lot of food safety information resources available for free online, but I will do my best to make as many food safety training videos for your staff and have those available on our CLS website. Also, moving forward, we have food handlers. This specific policy states that food preparation staff work should be under the supervision of a certified food handler. This can be ServSafe or another health department sponsored food handlers class. And this specific handler should ensure the application of hygienic techniques and practices in food prep and service. Service providers also need to be in compliance with local county or public health regulations. I know that many different counties have different requirements on this, so just make sure that you're in conversation and working with your public health or local county office. The next policy is regarding registered dietitians. It states that all registered dietitians practicing in Wyoming must be licensed with the Wyoming Dietetics Licensing Board. All facilities utilizing the expertise of an RD have to have a letter of agreement or some type of contract, including contract term, compensation, and required services to be provided. I do have a template for a letter of agreement made that's in the appendix. You do not have to use it, but you do have to have a letter of agreement or a contract with the RD. Next is a policy regarding therapeutic and modified diets. This specific slide kind of just breaks down the difference between the two and gives a clear definition of what a modified and a therapeutic diet is. Modifications of a meal that are not therapeutic are considered modified diets, and this would be participant preferences, heart-healthy meals, vegetarian or vegan meals, things like that. Comparatively, their therapeutic diets are individualized and address corresponding oral nutritional foods that are a result of surgery, disease, or illness. They do have to be prescribed by a physician, and they do have to be monitored and overseen by a RD. This would include diabetic, renal, gluten-free, or food allergy diets. Therapeutic diets can be eligible for reimbursement if and so long as they meet the Older Americans Act requirements. However, if they do not, feel free to reach out to myself or the CLS manager for additional guidance on this. We don't have specific instructions on this in the policies, but if this does apply to you, please reach out to either one of the managers. The next policy is regarding nutrition counseling, and know that nutrition counseling has to be offered by nutrition programs. It's not required to be completed, such as nutrition education, but it does have to be offered to eligible participants. And if it is provided, it has to be delivered by a registered dietitian. Reporting, 1 unit is equal to 1 session per participant. So in the past, it was time. It was based on time. Please know that this is changed. This is the correct reporting measure that we use for NAPIS, and it's no longer a time measured. It's just per session. So please do inform your SAMS personnel. Just make sure that you're following this policy. The next topic I wanted to talk about is case management, and this is actually no longer in the policies because it is no longer a required service. Basically, according to the definition, a client completing the AGNIS or receiving help completing the AGNIS is not considered to be case management. So it's no longer required, but we are still keeping it available as an option to track in assessments in SAMS. This was brought up in one of the presentations that reimbursement was a problem, but reimbursement is not based on case management, nutrition education, or counseling. It's only based on meal counts, so that's not a factor. And then the division will not be tracking case management or using information that is entered into SAMS. Please inform your SAMS personnel again and just make sure that you know this will no longer be a required service. Nutrition screening is a part of the division approved evaluation tool, and it should be provided to eligible participants through this tool. It should be completed at the time of intake and an annual update, and each service provider should develop appropriate policies for review of the nutrition screening and for making appropriate referrals for participants who are at a high nutrition risk. Please note too that as a provider, you're not responsible for checking or assessing nutrition scores as described on the determined checklist. If participants request a reassessment of their nutrition score, they should be provided the service. If you do have specific questions on this, please feel free to reach out to myself and I can explain this better. The next policy is regarding SNAP and states that eligible participants utilizing SNAP can use those benefits as a voluntary contribution toward the meal if they wish to do so. This is not mandatory and by no means do we require you to have an EBT machine, but if you do have the ability to accept SNAP benefits, know that this is an option for you to do. Also under SNAP, we have a section that says that the nutrition program shall offer information about obtaining SNAP benefits to each new eligible participant at the time of intake, and then at least annually to registered eligible participants. I do have materials for SNAP resources that are available from the Department of Ag. They are free and they can be shipped to any senior center, so I have that available as well. So that is a wrap up for the policies that specifically affect both C1 and C2. So now I'll move on to the policies that only affect Title III C1. The first being unregistered eligible participants. This states that eligible participants who refuse to sign the release of the division-approved evaluation tool, but they do give confirmation of their birth date, and this can be verbally or written, can be and will be considered an eligible participant. They do not have to pay the cost of the full meal and should not be coerced to do so in any way. These eligible individuals can seek reimbursement for their meals. And meal sites to do this need to keep a tracking log of dates and services provided to those specific participants. To help you better understand how to do this, Heather has created a SAMS video on how to enter these individuals into SAMS, so please see that available on the CLS website. Also included under this is that opposite, so eligible participants who refuse to give their birth date information, again, either verbally or written, will be treated as a guest and must pay the full guest fee for the meal. The key thing here is that a minimum of a birth date must be given in order for a participant to be considered eligible. So these specific individuals cannot be denied service, but they are not eligible for reimbursement. Again, I have the following listed materials. The AGNIS client information document is just a document that kind of explains what the AGNIS is and why it's important to fill it out directly for the consumers to have access to. Feel free to edit or add information to it that you seem fit, as long as it does not in any way state that they have to pay for the cost of the meal or that they would be denied service for not filling it out. Also included is the log sheet that I mentioned, and then finally we do have that video that Heather made available on the website. The next policy is regarding leftovers, basically stating that nutrition programs may choose to allow eligible participants to take home leftovers. If they do take home their leftovers, they have to be notified that they are doing so at their own risk. And they have to have signs posted at each meal site advising the eligible participants that they are taking them at their own risk, and to also have labels available and be offered for eligible participants to put on the containers. The label should have the following information: the date the meal was served, a use-by date 3 days from the date of service, and then the words refrigerate immediately or consume within 2 hours. I did go ahead and make a sign to post at nutrition sites regarding the policy information, and then also the labels with the information that is listed above. Please know that when I say labels, I don't mean literal labels that you print. You can just print the information from the labels with information document I've created and just tape them, or even just have them available for the clients to use. The next policy is temporarily delivered meals. An eligible participant may receive temporary delivered meals for no more than 2 weeks. If the participant is in need of meals for a longer period of time, then they should be referred to the C2 home delivered meal program. The following situations warrant a temporary delivered meal. Number 1, the eligible participant is temporarily ill and is unable to attend the congregate meal program. Or number 2, the eligible participant is unable to get to their regular congregate site on that particular day. Only volunteers for the nutrition program shall deliver temporary delivered congregate meals. Nutrition program shall advise eligible participants of food safety guidelines of the meal and that they are accepting the meal at their own risk. And then finally, all temporary delivered meals that are provided shall be recorded in the division approved data system as congregate meals linked to the individual participant. So if they are receiving temporary delivered meals, do not switch them into different services. So don't switch them to C2. They still would be C1. We're just going to link that with recording methods for temporary delivered meals. Moving on, we have specific policies for emergency meals, and these are broken down into programs, so C1 and C2 specific. Providers, please know that you are not required to meet this policy requirement by the end of this current fiscal year, which is federal fiscal year 18, just due to time and budget allocations, but it will be a requirement at the start of federal fiscal year 19. So specific to C1, Eligible participants attending the congregate meal site shall be advised and informed to keep a 3-day supply of non-perishable foods and bottled water in case of inclement weather or other emergencies that cause a temporary suspension of services. Eligible emergency meal packages may be provided at the discretion of the meal site. Just know that you can count emergency meal packages as an eligible reimbursable meal, but they do have to be in compliance with the Older Americans Act meal requirements. And that applies to both C1 and C2 emergency meals. Specific to C2, all nutrition programs shall offer all home-delivered meal eligible participants a shelf-stable emergency meal package. Emergency meal packages for home-delivered meals participants shall be offered to eligible participants at least each federal fiscal year. Distribution times may vary by region based upon local needs. The package should consist of 2 to 3 days of shelf-stable foods and shall be replenished by the nutrition program. The daily supply should correspond to the number of meals the nutrition program is providing. For example, if the nutrition program provides lunch and dinner each day, a 1-day supply of food would need to include 2 meals. Please know that we do have a subservice in SAMS titled specifically emergency meals, and please use this going forward if you are getting reimbursed for these meals. It will just help us in the future in tracking these meals. So within that specific policy, I transitioned from C1 to C2. Obviously, C1 and C2 policies are very similar, so there's only a few differences in the two programs. But this is actually the final policy, and it's regarding packaging and delivery. So meals shall be delivered to the participant and shall not be left at the door or anywhere unattended. This policy is pretty straightforward. If you do have specific questions or circumstances, feel free to reach out to myself or the CLS manager, and we can work with you on answering specific questions for your program. As I mentioned, I've talked about some of these things throughout the presentation, but within the policies, there is an appendix which contains the following. Appendix A has NAPIS reporting. Appendix B is just a copy of the Older Americans Act Nutrition Determined Risk Assessment. Appendix C is SAMS services and subservices specific for the C programs. Appendix D is the letter of agreement or contract with the RD. And then Appendix E is just local policies that weren't specifically talked about throughout the policies. And then finally, I have just a list of resources available on the CLS website. I did talk about quite a few of these things throughout the presentation as well, but if anything seems to be missing or something is not available that you need, please feel free to reach out to me and let me know. If you have any questions, as always, I'm available via phone or email. I'm always here to answer anything or work with you on specific policies or questions that you might have, so don't hesitate to give me a call or an email.